Assalamualaikum warahmatullahi wabarakatuh. Today we're going to present about our research that is relationship of sodium level to blood pressure. But before we start, I'm going to introduce myself and my team first. My name is Fasya Fatharani and my team is Fariha, Fatimah, and Fajril Umar. So for the first, I'm going to introduce about the background of the research. Hypertension is a condition where an increase in blood pressure above the normal threshold is 120 per 80 mm mercury. If the blood pressure is more than 140 per 90 mm mercury, it is declared hypertension. Increased level of sodium in the blood is one of the factors causing an increase in blood pressure. In 2013, the prevalence of hypertension in Indonesia has decreased from 31.7% in 2007 to 26.5% in 2013. At the level of Central Java Province, based on data from the Central Java Provincial Health Office on 2013, that the prevalence of high blood pressure is high, as many as 67.57% of cases. Seen from an epidemiological point of effect, them including age, sex, genetic, obesity, smoking, lack of physical activity, stress, and excessive sodium intake. Based on the last research from Sukarno IAR on 2013, in which the result of people who live in coastal area have higher blood pressure compared to people who live in mountains area. This research was carried out because based on the geographical status of North Bolang Mongondo Regency, which is located in the area around the seawater coast, where seawater seepage occurred to the walls that are around the residential area. The research question is how the effect of sodium consumption of high blood pressure in adolescents. How is sodium related to hypertension to adolescents? How is the relationship between high rate of hypertension in people who living on the coastal area? The purpose of the research is the effect of sodium level on blood pressure, relationship between sodium level and hypertension in adolescents. The significance of the research is the study aimed to determine whether there is a relationship between sodium level and high blood pressure to people who live in coastal area. This study is proposed to give contribution to medical officers, students, and other researchers as a reference. The scope of the research is the study is to analyze the relationship that occur between sodium level in daily consume, such as the water by the adolescent with high blood pressure that occur in adolescent around the coastal area. Thank you.
Okay, for the second, I will explain about sodium, teenager, and hypertension. Sodium is the main cation in extracellular fluid which function mostly to regulate osmotic pressure, which keeps fluid from coming out of the blood and into cells. In cell, osmotic pressure is regulated by potassium to keep fluids from leaving the cell. Normally, the body can maintain a balance between sodium outside the cell and potassium inside the cell. If someone eats too much salt, blood sodium levels will increase. The thirst acid will cause him to drink so much that the concentration of sodium in the blood returns to normal. The kidneys will then remove the excess fluid and sodium from the body. Aldosterone hormone keeps the concentration of sodium in the blood at normal values. The function of sodium. Sodium function in maintaining fluid balance in the body. The function of sodium is to regulate fluid volume, regulate fluid balance, regulate osmolarity, and regulate blood pressure. Blood pressure is the strength needed for blood to flow in blood vessels and circulate in all tissues of the human body. Blood pressure consists of two parts of systolic pressure and diastolic pressure. The source of sodium. Sodium is actually a natural salt that is contained in many plant and animal food products. Natural salt or table salt has been used for centuries to preserve food. Absorption and metabolism of the sodium. The amount of sodium that comes out of the gastrointestinal tract and skin is less than 10%. Next one is teenager. According to WHO, teenagers are residents in the age range of 10 until 19 years. According to the Republic of Indonesia's Minister of Health Regulation number 25 of 2014, teenagers are residents in the age range of 10 until 18 years, and according to the Population and Family Planning Agency, the age range of teenagers is 10 until 24 years old and not married. The next one is hypertension. Definition of hypertension is a conditional that increases blood pressure above normal and indicated by systolic numbers. Hypertension can continue to more severe damage such as stroke, coronary heart disease, and narrowing of the left ventricle or left ventricle. Besides this disease, hypertension can also cause kidney failure, other vessel disease, diabetes mellitus, and others. Hypertension is defined as an average systolic or diastolic blood pressure level at the 95 or higher percentage based on 3 spared readings. Symptoms of hypertension. Hypertension is another name for high blood pressure. This condition can cause severe health complications and increase the risk of heart disease, stroke, and sometimes death. Hypertension can be ignored by diligently checking blood pressure. For adults, a minimum of blood is checked every 5 years. Symptoms usually appear when chronic high blood pressure has caused damage to the body.
Relationship sodium with hypertension. According to Sunardi 2001, salt consumption in Indonesia is generally quite high, which is between 30 to 40 grams per day. Sodium salt is also needed by the body and minimum requirement is 0.5 grams per day. Kitchen salt contains 40% sodium. For example, natrium benzoate as a preservative in tomato sauce, margarine, etc. Natrium citrate used a drink such as syrup. Natrium bicarbonate, baking soda used a cake developer. If we had to limit consumption of sodium, we need to realize to keep away fast food, eat restaurant, avoid using canned food, stand food, and fresh food. In our body, there is a complex system so that a sodium level in the blood are maintained properly. Salt sensitivity is one component of the entire spectrum of cardiovascular risk factor, and there are differences in salt sensitivity between adults and young adults. Sodium is associated with the occurrence of high blood pressure because high consumption of sodium can reduce the diameter of artery. The effect of sodium intake of hypertension occurs too and the blood pressure. Rural communities that consume small amounts of salt have a proven history of lower of hypertension. The habit of consuming salty food is at risk of suffering for hypertension, but 3 times compared to people who do not have the habit of consuming salt food. Hypertension subjects had ratio of more sodium potassium intake, and 56% of non-hypertension subjects had a good ratio of potassium-sodium intake.
I will explain Chapter 3 on research methods. 3.1 Research designs. This research uses qualitative methods with branch case study methods. Case studies, in their true essence, explore and investigate contemporary real-life phenomena through detailed contextual analysis of a limited number of events or conditions and their relationships. Yin defines the case study research method as an empirical inquiry that investigates a contemporary phenomenon within its real-life context. When the boundaries between phenomenon and context are not clearly evident, and in which multiple sources of evidence are used. A case study is a unique way of observing any natural phenomenon which exists in a set of data. There are a number of advantages in using case studies. First, the examination of the data is most often conducted within the context of its use. That is, within the situations in which the activity takes place. Second, variations are in terms of intrinsic, instrumental, and collective approaches to case studies allow for both quantitative and qualitative analysis of the data. Third, the detailed qualitative accounts often produced in case studies not only help to explore or describe the data in a real-life environment, but also help to explain the complexities of real-life situations which may not be captured through experimental or survey research. In this study, a case study approach was used to analyze the relationships between sodium levels and hypertension in adolescents. 3.2 Site and participants. This research, conducted by Poltekkes in 2016 in SMA 1 Bolangitang, North Bolang, Mongondao Regency. This school was chosen because one of the researchers was a graduate of the school, and the location of the school was one that was close to to the research campus. The participants involved in this research were 21 students of second grade high school students. 3.3 Data collection techniques. Different methods are used in qualitative research. The most common are interviews, focus group discussions, observational methods, and document analysis. Combining two or more data collection methods, for instance interview as well as focus groups, or data triangulations, enhances the credibility of the study. In this research, the instrument used to collection data is document analysis. Document analysis is based on available sources such as government reports, personal documents, articles in newspapers, books, or medical records. Through this instrument, information needed to analyze the relationships between sodium levels and hypertension can be obtained. 3.4 Data analysis. After the process of the data collection was complete, the next step was taken was the analysis process. The steps that have been applied to analyze the data were: A. Recording the data. Fundamental data from this study was obtained from examination data. The data obtained will later be analyzed by conclusions drawn. B. Coding and analysis the data. All data obtained must be labeled based on the characteristics of the research subject. The inspections data is then analyzed. C. Interpreting the data. This section will answer the questions raised in the first chapter. Questions will be answered by on the data obtained. So that data will be displayed in the form of tables, diagrams, and the others. To make it easier for researchers to answer these questions, there are two questions asked. The answer to these two questions must be interrelated and supportive in order to explain the overall events and present an in-depth discussions. The conclusions. The findings obtained through the above stage and the data interpretations are rechecked to achieve research validations. The result of the research and discussions then drawn conclusions and suggestions to describe the overall research. Thank you.